Hi, my name is Leo Barber, and you are listening to the Vitals&Virtues podcast, where we focus on the pursuit of a virtuous life from the perspective of a nurse. Join me as I take in classical wisdom from the saints, philosophers, and scripture, and distill it for practical application that you can take with you on your way into your shift. Be sure to keep an eye out for special editions where I interview healthcare professionals from various specialties to help us learn and grow to be the best people and providers we can be. All right, and we're recording, and we're not doing any editing, so you just don't say anything inappropriate. I know I said no edits, but we managed to forget to track our vital signs here on Vitals and Virtues. Justin had a blood pressure of 118/82 and a heart rate of 68. I had a blood pressure of 130/72 with a heart rate of 68. And mind you, this is right after cold plunge and a max set of pull-ups right before hopping onto the pod. So I don't think either of us can really complain about either of those vitals. We were too cold to get an accurate pulse ox or temperature. So there's that. All right, now back to the show.
I'll do my best.
I mean, I guess you can say whatever you want that's inappropriate, but it's just going to get broadcasted to the 12 people that listen here.
I'll try to keep it HR appropriate. I don't need any more HR emails.
Yeah, I think we both have gotten enough of those. Anyways, here we are on Vitals and Virtues. I've got my good buddy, Justin Rizer, here to come talk about drugs and Jesus and everything in between. He's a toxicologist and an ER physician, so it's not weird drugs, just ones that'll mess you up, I guess.
Well, thanks, Leo, for having me. I'm a big fan of your podcast. I've listened to all the episodes.
What?
And yeah, it's good, man. Happy to be here and hang out with a friend and get icy and cold plungy and talk about
how did that treat you?
It was cold. It was very cold. Blocks of ice up to my neck. So that's new for me.
You felt like you were like going down on the Titanic, like you were Leo DiCaprio just sinking.
I would have been pushed away into the ice. Like Rose would have pushed me away for sure.
Yeah. I mean, look, neither of us look like that guy. I got a whole bunch of questions because I posted on some social media stuff that we have you coming out here to talk the whole drugs and Jesus thing, you being a toxicologist, which is fascinating to me, which I don't think you knew that I was fascinated by you in general. Because we've always worked in the ER together. Almost
Absolutely.
Got a fish hook in my eye with you once.
That was my mistake. I apologize.
I should have been wearing goggles,
I've learned some new tricks since then. New tricks since that first time.
That's right. But the whole, I haven't, we've never actually had the opportunity to talk like why you decided to go into tox or even the ER or medicine in general. Cause usually we're working and, our goofing off doesn't allow for quite that much backstory.
No, it's usually pretty busy. And even when we hang out, it turns into other stuff. But yeah, the reason for going into tox, I guess I'll talk to emergency medicine before cause I went to tox afterwards, but when I was in med school, I liked everything. I liked a little bit of everything. And
why'd you go to med school?
So that's also a good question. So I was too short, goofy, and uncoordinated to play professional sports.
Me too.
So my parents said that you have to go to college and do something with your life, and it's kind of funny. I actually really liked the show ER growing up as a kid. I was fascinated by that. I loved the little scene where Eric LaSalle's like doing the little punch thing and the intro and helping people. So I wanted to help people. I wanted to, I was good at science and math, and like I said, couldn't do professional sports. So I wanted to be a doctor probably around like high school. I think I knew I wanted to go into medicine and do something like physician-y, doctor-y. So then that just continued. I did pre-med in undergrad and kept going. Actually, kind of a cool part of the testimony, the Jesus part of the drugs and Jesus is so when I was applying for med school, I applied kind of late in the cycle. I didn't really understand rolling admissions, and so I applied towards the end of the deadline, and I thought I had a pretty good application. I did all kinds of different stuff, shadowed, and had good grades and all that sort of thing, but I got waitlisted by several schools, and I basically had to make a plan. It was like June before school was going to start, or like May or June before med school was supposed to start in the fall, and I still hadn't gotten acceptance. So I was like, man, I need to come up with a plan for this gap year, which a lot of people do, a lot of great physicians will do, but I didn't really have a plan. So I was like, I need to start thinking about that and applying for the next year. So I worked in a Alzheimer's research lab, doing like experiments on mice and stuff for Alzheimer's research down in Tampa. And I'm sitting there at my microscope, which I was looking at slides and doing all that sort of thing, and thinking to myself, okay, I'm going to submit my application tomorrow for the next year's class, the following accepting class, because it was the first day. I was like, I'm not going to miss the boat this time. I'm going to get my application in and not screw up like I did before. And I'm sitting there at the microscope, and I just pray. And I'm like, God, like, just please, like, this is what I feel called to. I feel like you've called me to do this. Like, I really want to go to med school and be a doctor and that sort of thing. So please just bless this application. And I was like, okay, I'm going to wait. You know, it doesn't matter if it's the first day or the second day. I'm not waiting till the end of the rotation. So I'm going to give it one more day, double check, make sure everything looks good on the application, that it's 100% like the way I want, ready to go, so I don't, you know, get in this situation next year. And so I do that. I sit and pray. It's the end of the day. It's late. There's like hardly anybody in the office. And I get a phone call, and it's from the student affairs at USF, which is the undergrad I went to, which is one of the schools I was waitlisted in. And they say, hey, how would you like to come to our school next year? And I like just astounded, was like, absolutely. Yes, I'd love to come. And so that same day, like, I mean, minutes after saying this prayer into a microscope, I get this call, and I literally, it was like the eureka moment in a movie. I'm running down the halls, just excited and happy, and I didn't think anyone was there. But come to find out, there was someone else who was staying late trying to get their work done with me, and she came up and said, hey, I know I don't know you very well. I work in the office, but we don't work together that much. But, you know, sometimes God will tell me things. And I was a little like, whoa, push back. Like, what do you mean tell you things? And because sometimes those people are very well-meaning, and sometimes, you know, there's other things going on. And she's like, I just feel that God is telling me to tell you that this is a second chance for you to, like, give your like life to him and live for him. Like I you know, gave my life to Christ and believed in Christ before then, but she said that this was sort of a second chance for you to like live for him, basically, and saying like, you know, depend on me and not on yourself. And so, man, what a like block of time and chunk that was, and how important that was in my life and growth moving forward, and how I tried to treat people.
I accidentally muted my mic. It's probably best so that you guys don't hear me swallowing coffee and whatnot. But had she, had you told this person that you were, or were you just like screaming through the halls, like, I got accepted?
So I think when she saw me like right there, she's like, oh, what happened? And
your mic isn't red, is it?
No, it's green. Okay. She said that, or when she heard me or like saw me, I think people in the office knew I was wanting to go to med school. So I think it was sort of known, but she's like, you know, congratulations, what happened? I was like, oh, I got into med school and da-da-da. And she's like, yeah, it just felt that it was put on her to say that to me.
That's pretty
I was like,
cool.
all right, that's pretty bold, because I don't know, you're probably better at this than I am. I find it sometimes hard to share my faith to people, even though there's lots of amazing things that God has done in my life. But it's just hard for me to speak it out to people sometimes, and so for her to do that was a huge blessing. But yeah, so that was part of the testimony of getting into med school. And so then I guess next step, why emergency medicine? So I ended up liking everything. And I feel like that's what people who go into emergency medicine, they like a little bit of everything. And I really liked orthopedics, actually, the bone stuff and cutting on bones and sawing stuff and whacking hammers and things, but it's so subspecialized. I didn't want to be like the left ankle guy and only do like left ankles. So I liked the variety of ER.
You're going to have to find a different physician. That's a right ankle.
Yeah, no. Sorry, I don't do, right side. Oh, they told me the wrong. I don't want to do left. But so that's part of why I went into emergency medicine is the variety and just keeping those skills. And I feel like it would be cool to go somewhere and somebody's like, you know, we need help on a plane, or like, you know, call a family member and they have a question and I could kind of help them. I may not know exactly what's going on, but I have some idea.
You've just always wanted to be like somewhere, and they'd be like, "Is there a doctor in the house?" And you're like, "Yes." So that was you when you were
exactly
nice,
yeah, nice. With that same high pitched voice.
You know, it's funny how that goes, because like anytime I'm even imitating me as a younger me, it always goes to this Mickey Mouse type voice. It's like, why do I do that? But
oh boy,
that's right. Well, it was funny is speaking of, like, I was just telling somebody this recently, the whole like, is there a doctor in the house moments. We both worked in the ER for how many years, and I am the opposite. Like, if I'm out and about, I don't want people to know that I'm a nurse. I'm just a hobo, you know, like that's what I want. And I think there's a lot of ER nurses who have that, which is probably the wrong attitude. But the story that my wife and I used to do travel nursing, and we were up in Vermont, and we were like, hey, let's go to Montreal. So we go to Montreal, and then we go to this light show in a Notre Dame, like this basilica up there, super pretty old church, like built in the, I'm going to butcher when. Anyways, it's an old church.
Sounds amazing.
Super, like, cool that they have a light show in there. I kind of am skeptical on having light shows in churches now, but so we're there and we're sitting in the back, and this is a huge church, huge, like from like the altar to the back of the church is probably like 100 yards or so. Like, it's a big building. Yeah. Well, we're in the back, it's about to start, and we just hear somebody start shouting like, oh, I need a doctor. And we're like, oh, I like put my feet down, and I was like, I'm not going anywhere. Somebody else up there is going to go and
it's
deal
a
with
big
this.
Church. There's lots of people.
Yeah,
right?
yeah. Like there was probably 70 to 150 people. I have no idea how many people were there, but it was a lot. And I was like, somebody closer to that person is bound to be a medical professional. And they kept shouting, so Lexi kicks me in. Finally, I get up and I run down there, and there's this dude that like passed out in the pew with his head like, ah. We're like, oh gosh. So Lexi's like, hey, we should probably get him like laying flat. Of course, you know, she's a NICU nurse and I'm a ER nurse, and I'm just like, I don't want to do this. My brain had fallen out. But she says this, and I'm like, all right, well, we get him out of the pew, we lay him down flat, and he kind of wakes up. And what was funny is before he was even out of the pew, I'm still shivering like crazy. Ice bath, man. Activation of brown fat, I suppose.
There we go.
So before we even get him out of the pew, like, two people are trying at the same time to check carotid pulses, and I'm like, nope, get your hands off.
At the same time?
Oh yeah. I'm like, no, please stop. So I like bear hug this guy, get him out of the pew and lay him flat, like on his side, just in case he's like gonna puke or something. I don't want him to aspirate. And he wakes up, and I'm like, hey, what's the deal, man? Like, tell me your name and your birthday, or, you know, trying to figure out if he's oriented, and he is. I'm like, all right, well, why are you passing out? You diabetic? Like, what's going on? He's like, no, I have no medical issues whatsoever. I'm like, all right. So I'm shaking.
You're like tremoring cold, teeth chattering.
I know. I'm gonna crack some teeth. So he like passes out again for a minute, and his girlfriend, I guess, is like kind of giving me an update of what their day looked like. I'm like, well, I don't know what to make of this. Mm-hmm. Told her to call 911 pretty early on, or whatever it was in Canada. And she ends up like I can hear them coming, and then over my shoulder, some old guy like steps up, and David is the guy's name. He says like, I had he tells me about his day. He was out and about, took a walking tour through Montreal. He's like, we probably walked 10 miles. I threw up a whole bunch.
Oh gosh.
I drank some alcohol, but I didn't want to miss this. And I'm like, oh my gosh, you have like a viral illness that I now have because I bear hugged you to get you out of a pew.
Oh
and I'm like
gosh.
furious in my head, like I'm about to like have a GI bug on my little vacation thanks to this guy. And then the old guy who steps up, he's like in a button-down white shirt and khakis, and he's got like shaggy white hair, and he's like, what's going on here? I'm a doctor. Why is this man on the floor? And I'm like, oh gosh, he's probably a podiatrist. He's like, who are you? What are you doing? I'm like, my name's Leo. I'm an ER nurse. And, this dude is obviously French speaking. And he's like, well, this man doesn't need to be on the floor. Get him up. He's obviously fine. I'm like, where were you when they called for a doctor?
Right, multiple times.
Yeah,
sir.
yeah. So, like, obviously, I'm over it. So much so over it because he's telling me that he's going to puke.
Yeah.
Or that he'd been puking all day. So Lexi and I just got up and like, all right, David, good luck to you. The EMS are like coming in the doors.
Ew,
like,
David. Ew.
So that's like the one opportunity I had where somebody's like, I need a doctor. And I was like, okay, I guess I'll help.
Yeah.
Not a doctor, but
So to your point, I don't want other people necessarily to know. I just like the idea that I have the skills if it was needed, like I could help out in a situation. Like when I go get my hair cut, and it's usually at Sport Clips because, I'm not fancy, but like...
You look kind of shaggy.
Like
I don't cut your hair after
we
this,
could.
too.
I need a shave. Do you have like a straight razor? I dread when they ask, so what do you do? I'm like, sometimes, I work at the hospital. I've considered just saying like completely random things, like I work at McDonald's or like other things, but it's just,
but you don't want to be a
tell
liar.
I have to tell the truth. So I'm like, I work at the hospital, and they like keep going. So yeah, I don't necessarily like, because
unless it's a cop and he's pulled you over, then you're for sure pulling out
then
the
absolutely
doctor badge.
just leave my badge just draping on my shoulder gently since
Right.
like, hi, I'm on my way to the hospital. There actually was a cop on my way to this podcast. There was a cop in a speed trap on 460, but I wasn't going fast.
They're always on 460.
They're always on 460, but I was minding my manners and my lead foot, and I was going the speed limit, so we were okay. I didn't have to pull out the badge.
Yeah. All right, so that was why ER. You want to do a little bit of everything. So Tox.
So in my ER residency, so I grew up in Tampa. I matched into Charlottesville and UVA, and that's where I did my emergency medicine training. And there, like, two of my top mentors were both toxicologists, and they sort of encouraged me to do it, but they were also cool guys. There's like two toxicologists. There's like the wilderness med snake bite cool guys that I say cool. I'm not cool, but I say cool. And then there's like the super uber nerds. All toxicologists are nerds. We're all nerds by trade. But there's the cooler nerd and there's the nerdier nerd. And so then there's the guys who like just enjoy drawing chemicals and like the research and all that. And so both of my mentors were like the wilderness med and hikes and cool stuff. They were just super guys. And so I kind of went under their wing, and they offered me a fellowship spot there at UVA. So I stayed on. I also thought it would be something really like to buffer the ER, just doing like night shifts when I'm in my 50s and 60s. I'd have something else to sort of coordinate that with. And I like the teaching, the opportunity to like still teach med students and residents and things like that. So it gives you kind of an in and a niche within emergency medicine. So that was kind of a niche that I liked, and my mentors were super, super cool too.
Yeah. Well, that's something that you point out, like medical, like the doctor world, you pretty much, you niche in really, like that's it. Like unless you have a fellowship in something very different, was it Dr. Logan was telling me about this. He was like, I am envious of nurses because of the flexibility you have. He's like, some days I hate emergency medicine. But I also would hate being an orthopedist where I'm only doing left ankles.
Right.
So I guess like being in the tox world, you get, that's at least you have two different things that you could do, I suppose.
Right. You have a little variety there.
Either that or like urgent care, and I suppose you could do like primary care. There's just only so many options I suppose you have as an ER physician.
And you can go into tox from internal medicine, emergency medicine, and peds. You could do, but you can't. There's other stuff that you can't go into tox from. So a lot of those people still, I'll take some more.
French maid outfit.
That's why you're still so cold. Put on some pants. I'm just kidding, everyone. He's actually wearing pants.
Perfect.
Oh, back to tox. But so I mean, a lot of people who go into tox still have to do other stuff to support their toxicology endeavors, because tox is very preventative and supportive. So just like family medicine, it doesn't provide as much in funding, and like research is always, requires a lot of support. So a lot of people do either their ER shifts or their internal medicine shifts to be able to support their tox habits, if you will. But it intersects with so many things, because like a lot of our patients are overdoses, right? Like suicide attempts and things like that, and overdoses. And it intersects with
it seems like there's a whole lot more of
ICU.
that these days too.
Oh my
like,
goodness.
I don't want to say like since COVID, but it kind of seems like since COVID, way more people are suicidal.
Yeah, and it seems like it's getting younger, which is a
Yeah.
little sad. Like, the 15-year-old overdose on aspirin was a kind of common sort of PICU scenario we'd have when I was in fellowship, and now, I mean, we're seeing like 10, 11, 12-year-olds like literally overdosing and needing admission, and it's a little scary. The other thing that's a little scary is the, no matter your sort of political or moral stance on it, but the more legal marijuana and THC products become, the more little kids get into it. Because when something says like Starbuds and it looks like Starburst and it's actually THC gummies, you're going to want to, some kid's going to want to have that. My kids want candy all the time.
Yeah.
So
Yeah, that is it. It's things like that I've never been a big fan of marijuana for, I suppose, a handful of reasons, but it's stuff like that I wouldn't think of just because it's not like, I don't know what this stuff looks like, so I wouldn't suspect it. So, gosh, so many more, like, just more avenues of approach for all of these, like, weird little problems that weren't prevalent, 10 years ago or so.
It's true. But that's where I get to come in and help people and use those skills. And
how in the world are you
and
still
talk to
so
you
warm, man? Like, I am still frozen over here.
Dude, I've got like 3 layers on.
I guess that's
and
true.
Sweatpants, yeah. That's why I brought my long fuzzy socks, because I was preparing.
You were prepared. I do this all the
prepared.
time, though. And I'm still freezing my butt off.
That side, though, near the wood burning stove was definitely warmer than it is over here.
It's like 10 degrees warmer.
Yeah, so maybe that's it. I have to move the podcast, slide it
next
over.
Next time. I haven't had anything to eat today, or at least I haven't had a whole lot to eat today, so there's that. Anyway.
So what, can I ask you a question? Can I ask the podcaster a question?
All of them.
What prompted you to make the change from, like, I don't want to say regular nursing, but bedside clinical nursing to nursing supervision?
Honestly, it's funny. COVID. I got so burnt out of using, like, the donning and doffing of everything. And just like, I started, I used to be a whole lot more of a helpful person when I did not have to throw on all of these, masks and gowns and gloves and every time. And then the isolation, like, not just like isolation precautions, but just isolation in a room.
Interpersonal.
Nowadays we're back to kind of how it used to be. Like, most ER nurses are like, whatever, I'm just going to deal with it. But there was, you're knocking on doors and hitting call bells as the nurse providing care because you're just you. You didn't have the whole group of people coming into, the gangbang. We're going to take care of this patient.
Yeah,
They're going to have
approach.
all of their labs, Foley, like all of the care, especially like the 80-something-year-old, like febrile patient. It's like I just don't. I wasn't so motivated. Like I would still go and help out, but I wasn't like as eager to do it. I wasn't getting up and like trotting in to help out my fellow nurses. And not to say like, oh, well, it's different now that I'm a supervisor, because like now I just have to do that for the whole hospital. And I think this is actually something that we could kind of like turn into the virtue of like being charitable with our time or very helpful with our time. It's very often like my time isn't mine. Like at home, it's my family's. At work, it's my coworkers. Like my time isn't mine. I think a good supervisor recognizes that they are the servant of the hospital and their coworkers. I mean, yeah, we have to deal with some headaches here and there, whether it's from visitors or family members or, chlorine gas leaks in the town, whatever the problem might be, or burst pipes. Or there's all sorts of that goofy stuff that you have to respond to, and you have to try to mitigate some issues where you can.
You've helped me out with a few family members from time to time, and I appreciate
gosh,
your cool-headedness.
You and the other Rizers, like, I didn't like that Dr. Rizer. Oh, here's the oncoming doctor. His name is also Dr. Rizer. That was great. But that's kind of why I went from bedside nursing to supervision, because I also, like, there's a lot of... whenever there's a code on another unit, and I ended up going to most of them when I worked in the ER and getting to interact with the other units, it was just an opportunity to I enjoyed helping other people out, and I've always enjoyed helping other people.
Sure.
And I just saw the opportunity for supervision as maybe another opportunity to bring some of like my talents to other units, I suppose. And I also really used to love the idea of doing labor and delivery. Like my two specialties in nursing that I wanted to do was ER first, and second was labor and delivery.
Oh, interesting.
I didn't actually ever apply to labor and delivery just because I was like, it'd be kind of difficult to do as a male nurse. The best male nurse, the best OB nurse that I'd met when I was in nursing school doing those rotations was Gerald. He was a male nurse, and this has been 10 years now that I met this guy. I can remember his name. I can't tell you the name of any other nurse that was a preceptor in nursing school. One of these days I'll warm up and I won't sound like
I was going to say, yeah, we can pause and come back to it.
Yeah, well, we'll probably have to
that's funny that you
anyway,
say that, though, about the OB thing. I actually really enjoyed the OB rotation and, like, the combination of, like, there's some procedure in the C-sections. There was some clinic, like from a physician perspective. I actually liked it, but yeah, it seemed there was a lot of, and obviously nothing against females. I appreciate and respect all my female colleagues, but just being amongst a majority female specialty and helping in women. I don't know. I'm not a woman, so I can't speak to that perspective, but I would think I would feel more comfortable if it was a female delivering and that sort of thing.
If you were a woman, you would want to have a woman be your provider.
Yeah, if like OB and gyne care, that's what I would think.
I got you.
Like if I need a urologist, I'd probably prefer it be a guy. Just, it doesn't have to be, but I'm just saying I would probably prefer that. So I don't know, that's just
yeah. I really enjoyed that. So that was another avenue that I could like kind of do a little bit of stuff with in different units. Like I've scrubbed in for a C-section, which I was later told that wasn't my role as the supervisor. But nobody knew who I was because it was like my first shift off of orientation as a supervisor, and it was like a stat C-section where you just like splash and go.
Right.
And I think everything turned out well with that one, but it was just like hey, who's this guy? Scrub in. And it was, I'll be honest, it was
like we need all hands on
that's
deck.
why it's really important that we do antibiotics, because I haven't done anything in the OR ever. So when they're like, scrub in, I used the towels on like the dispensers. I was like, oh gosh. And then there's some stuff on the wall that I squirt on my hands, and then I go in and I'm all like, all right, let's try to get some gloves on, and nothing worked. Then I just ended up holding a bladder blade for the whole time. So
that sounds a lot like what happened in med school. Man, there is nothing more embarrassing or to make a scrub nurse more mad at you as a med student than if you like break gloves or you break sterile field and have to go redo it. Oh man. Ooh, those were some times.
I'll have to get some of the OR nurses on here. That'd be a fun time. You can talk about that.
Yeah,
too, from their perspective.
Oh man, the fire in the eyes, because that's all you can see is their eyes anyway, because everything else is covered up, and to see, like, you could feel your soul. That would warm you up. The heat coming from the eyes of an angry scrub nurse.
I really thought the little shot of Grand Marnier would have warmed me up, but
maybe number 2.
And the coffee hasn't done anything.
No, I'm holding the coffee. That's helping my hands.
Maybe that's helped you out.
Cup the cup of coffee.
Yeah.
That's fascinating. But yeah, I mean, you get to dive in like you're at every bad situation, right? As a nursing supervisor.
Yeah. Well, and especially at the community hospital level. Like in a bigger facility, maybe not so much, because you've got like met teams and stuff like that.
Yeah, I hardly ever see our nursing supervisor at Lynchburg General.
Yeah.
Maybe I do and I don't recognize them.
There's that. That's possible.
But like you're in the nitty-gritty with us on when stuff is hitting the fan, you're down there with us.
Yeah, I would like to be. That's a good, that makes me feel good that that's recognized.
Yeah.
It's like, oh yeah, this guy, I don't know where our supervisor is. Which I remember when I worked at LGH, like we would see the supervisors at least a couple times a shift. So like I have good, but that was like 7 years ago now.
Yeah.
It's been a while. Which in the grand scheme of things, I was telling Lexi yesterday, I'm like, I'm old. And she's like, why do you say that? I was like, just thinking like I'm about to be 33, which isn't like, honestly, it's not terribly old, but
you're still in your early 30s.
That's right.
So I'm so old I don't even remember how to say words right.
Yeah, I'm just too cold that I can't say words right. So yeah, that time balling on some old dudes. All right, you tell this story. This cracked me up.
Oh my gosh! So there was this young guy who came in, had an orthopedic injury. I forgot where it was hurting him, but we were crazy busy, and he was like in the hallway. And you weren't doing nursing supervision.
No,
you were just still clinical ER nursing. And we both kind of walk up together and talk to him, and we were like, yeah, what happened? He goes, I was just balling on some old dudes. He's like, you know what I mean? They they had wife and kids and stuff, and we both look at each other, and I had 3 kids at that point. I think you had 1 and maybe 1 on the way. And we're like, us. Like he was balling on us. We are old dudes.
We looked at each other, and then like he said, like, yeah, they were like you. And we both just were like, I felt just sad inside, like, also like, just discharge this brat,
Right. Clearly you're not that bad.
Yeah, I think it was something. Honestly, I think somebody like, as they say, broke his ankles because he was getting balled on. Apparently.
He was getting balled on.
He tells us the story that he was balling on some old dudes, but the old dudes were not there in the ER.
Hey man, those old school basketball players, man, they know what's up. They were dealing with elbows and like the early 90s MJ days, the Pistons, the Bad Boys.
Dude, I would have no idea. You're just old enough older than me that you would recognize those folks. Yeah, and I know Michael Jordan, but I did watch, was it The Last Dance or something?
Oh yeah,
that was a good documentary.
That was a great documentary. I loved. I was a huge Jordan fan growing up in basketball. It's like my favorite. I love the Bucks, but my favorite sport to play would be basketball, and I loved watching basketball growing up as a kid.
I'm short and white, and this is just not going to work out for me.
Yeah, right. I was also a lot more rotund when I was a kid
You were a
too.
portly Jap.
I was portly. I was slow, short, and didn't have very many like athletic skills. But man, I kept going. I kept trying.
Yeah, I was like, I really like, football was my jam. I played a little in high school, and I ended up getting a couple letters to go play at some like D3 schools.
Oh, nice.
It was mostly like, oh, we can get you an academic scholarship, but we'll just like funnel you, in the football programs. And I was like, I don't want to like have $40,000 of student loans per year.
It was like private schools.
Yeah.
Oh, nice.
So I was like, I'll just enlist in the Marine Corps. And then my mom saw like the like acceptance letters with the what are the scholarships, and was pretty furious.
Oh man.
I mean, rightfully so, I suppose. I mean, as a bright kid, I was just like, I want to play football, and there's that voice again.
Yeah, there it is. Yeah, there's young Leo.
That's right. I want to play football. Oh boy. So yeah, I ended up going and doing that. But I have a boatload of questions.
All right, yeah. Let's do it. Let's jump in.
Because you're the one that's I'm supposed to be interviewing you. You're not. Unless you've got good questions for me. So I've got two. I've got a whole bunch, and then I've got a pile on my phone. I just wrote some of them down.
Oh, all right.
All right. So Emmy wanted to know, how do you feel like drugs have impacted the way that you view God and your relationship with Him? And part of me wondered if, like, maybe in my Facebook or like those prompts were confusing. But how does that? I don't know if there's a way to simplify the question, but.
Well, yeah. So the drugs and Jesus and everything in between. It wasn't the drugs leading to Jesus, and I have not.
Good. That's what I wanted you to get at.
Yeah, it wasn't. I don't have this recovery addict story. I mean,
darn it.
That I can sort of proclaim, but I guess so. I mean, I don't have yet for that question if that's what they were getting to. Like, I don't have this oh, Jesus saved me from a life of drugs and alcohol and condemnation. I was actually, though, not as wasn't at the bottom of the barrel or addicted and strung out or anything, but I did use alcohol probably a little more than I should have in college, and experimented a couple other things, but that wasn't part of what brought me to Tox and things like that. I did listen to a lot of rap music, and so there's all kinds of references to drugs, and I feel like how I grew up, there's a lot of people that use drugs pretty all through school. I even got offered to sell drugs as a middle schooler. I was in 7th grade, and one of my friends was like, "Hey man, you wanna sell some weed with me?" And I was like, "No, but thanks for offering." So drugs have always been sort of around, and I feel like if I can help people overcome that, then that's good. But there's not a particular connection from that standpoint, other than when I see people who have overcome that addiction and attribute to a higher power, or when you get to help people who have overdosed, and you can say, hey, Jesus loves you, I'm glad you're here. That's usually my phrase of when people come in overdose or they were suicidal, I'm glad you're here. I'm glad you're here to get help.
Yeah.
Because we care about you. Somebody cares about you.
Yeah. Yeah, that is, there's, like we talked about, there's a lot of that that's going on. So honestly, there's a lot more opportunity for that, saying hey, I'm glad you're here to get help. And Jesus loves you, which I think that might be a weird line that I'm very willing to cross within our work parameters. Cause I'm sure somebody in some hospital, office might say hey, you can't say Jesus loves you to your patients. To which I'll say, what are you talking about? Yeah. It's just going to happen. It's just what it is. And I think over time, maybe as I've gotten older, it's been easier to do that. And the way to do that, because there is I suppose a line. We had a guy that was a STEMI at 4 a.m. And I had a feeling when I saw the guy walk in, I was like, he looks like he's probably a STEMI. Mm-hmm. And sure enough, he was.
Nice.
it's weirdly satisfying when you call stuff like that and you're like, oh gosh, no, I don't want to be right on this.
The spidey senses are correct.
Yeah. But it's like, are you a praying person? Like that's usually my go-to.
Yeah.
And everybody knows the Lord's Prayer, or most people do, and then you can kind of like ask that way. And sometimes that's like it's a decent segue. I've found where nobody seems to get offended by it, and it's also putting the ball in their court. So that's a solid in for me. I don't know what your kind of like a go-to on that front is.
Yeah, I find it a little harder in the ER actually, and that's something I would like to personally improve on, is just my interaction and sharing of that with. I have a friend who's a surgeon, and he says he'll offer to pray with all of his patients before they go to the OR, but he has that established relationship. Like he's seen him in the clinic at least once or twice, and sort of known them and brought that up. And, you know, especially before like the ER sometime, or before going into a surgery, I feel like a lot of people, I'm going for surgery. Like, yeah, sure, I'll take prayer. But sometimes your first time meeting this person, maybe they're confused and so sometimes I find it a little harder, but I think that's also just me making excuses for something that we are called to do as Christians, which is to proclaim his love.
Yeah. That's something that I struggle with a lot for a long time too. Like it wasn't until a while ago, you know, probably like 3-4 years ago, a friend of mine here in Farmville, like we used to, well, he still does it. I just, you know, it's difficult to get to the brewery with the kids, but we would go and like pray the rosary while we were there.
Nice.
And I was, you know, like the rosary is just like a very, I suppose, unique prayer. Like a lot of folks who don't understand it, you know, kind of take it as like you're praying to Mary, worshiping Mary. It's like, well, that's not what it is, and maybe not. We don't need to go there today, but it wasn't until we did that in public that I was like, yeah, why am I so afraid to like kind of go proclaim it in a way? Like I used to always have this, if I'm not living my life in a way that's, you know, screams at people that this guy has something different, then I ought not to be like trying to cram Jesus down people's throat. And then like there was some sort of connection there that happened where I was like, well, if you're saying that you're not living, if your example isn't good enough, then I ought not talk about it. It's like, well, then one, that's a cop-out. That's saying, my example should, but we also aren't called to just like be an example. Now there is the like really good quote. It's like, we're all called to spread the gospel and if necessary, use words. Yeah,
that's what I was thinking when you said that. But
it's such a cop-out for a lot of guys, I think, because you're like, well, you know, and it's difficult to
I'm being
navigate
nice.
Yeah. Jesus wasn't a nice guy. Like he was a very direct guy, you know?
Yeah.
But, all right. I had one a question from Beach Mom 786, probably not her real name. Why did I choose nursing? That was the only question that I got.
Nice.
I went into nursing because I had a lot of family that my older sister's a nurse, and I have an older cousin. Poor Danielle. Now she's getting labeled as an older cousin, older than me cousin, who is a nurse. She's actually a nursing supervisor up in a hospital in DC, I think.
Nice.
And they both seem to like enjoy their jobs, and it's like an opportunity it's like a corporal work of mercy where you're actually able to help somebody physically. So that was something that was very like catching for me. And then when I was in the Marine Corps, combat life-saving was something that I really appreciated. Like it was a cool thing. Like I never had to do any like, you know, patch somebody's sucking chest wound in the field or anything like that. Didn't have to look at, you know, no battle sign or whatever. Like none of that happened while I was in the Marine Corps, but we had to train on it. So it was cool stuff to learn. And I always ended up, I had kidney stones, so I always ended up in medical for my own nonsense, and just hanging out with the corpsmen, and a lot of them were in nursing school. And I was like, this seems kind of good. And bonus, there was this really pretty blonde girl that was going into nursing school. So I was like,
always
if
about a
I do nursing, I'll just, be in proximity to this girl. And it worked out,
Nice.
we're married and have 3 kids now. So that was
Nursing for the win.
Yeah, it worked out for me. That's kind of like the short answer of why I'm a nurse. It's just an opportunity. And there's always like, at the end of the day, I can say that I helped somebody.
Mm-hmm.
Where if I was, I don't know, doing some other jobs, I might not be able to say it with the same conviction, I suppose. At one point, I wanted to be a trauma surgeon. But it's a good thing I didn't, because I am one arrogant son of a gun. So,
and you would have been more so
I
as
know.
a trauma surgeon.
Yeah. So all right, so you matched in Charlottesville, which explains how you ended up in Central Virginia.
Correct.
But, well, I don't know. I don't want to, like, go too personal, like, but how you ended up in, like, at Lynchburg versus at UVA, I suppose.
Yeah, so my wife and I met. Angel's my wife. She's not in medicine. We both grew up in Tampa, Florida. That's where we met and got married. We actually did long distance for a while. She went to college in Dallas while I was in med school, so that actually worked out well for us. And then I matched in Charlottesville, so she tagged along because she liked me. We got married.
She liked you.
Yeah, she liked me. We matched in March, and then we got married in May, and we moved up there in June.
So were you married in med school then?
No.
In
We
residency.
got married like at the end. Like I graduated med school like May 10th, and then we got married May 26th. And
nice.
Moved up to Charlottesville
Not
like
at all
2 weeks
stressful
later.
time.
Oh
Not at
no,
all.
we do big life events all at the same time. That's
Yeah.
just our MO. It's just why one at a time.
Yeah, just get it over with.
Yeah, exactly. But then we fell in love with seasons. So like fall, having an actual fall.
Oh, yeah, because
is
Florida, it's,
amazing. Yeah, it's hot and hotter. Those are your
yeah.
2 seasons. Yeah, summer and summer light. That's what you got in Florida.
Yeah.
Which, if you enjoy unwrapping your Christmas presents in shorts, then Florida's all for you. But she's not a big fan of the heat, so she really loved this kind of mid-Atlantic, a little bit of everything season. So we stuck around, and a couple buddies from my residency class actually worked for Centra. Dave Kumar and Kyle Kinley, they were both in my class. Yeah, those guys. Funny now, Dave is actually working in Tampa, but
that is funny.
That's a whole roundabout story.
Just traded, places.
Yeah,
that's
just
all.
traded. It's fine. He went from Wisconsin to Tampa, but so that's how I got connected, and then it allowed me to stay in touch with the tox thing. So I still work part-time at UVA at the Poison Center, doing the tox thing, teaching and taking calls. So it allowed me to do both, because there wasn't actually a job available when I first got out of fellowship at UVA. So
Gotcha.
this sort of let me do a little bit of both worlds.
Yeah. So what, like, so far as ER medicine, like, it's changed a lot since we started.
Amen.
Like, a lot.
Yeah.
It was funny. At one point, while, I don't know, this is tangential, I suppose, but that's just me in general. I remember, like, one night at Southside, you and I it was like a crazy busy night, and I was, like, thinking about going to NP school. And I'd been thinking about it for a couple months.
Yeah.
And there was a night, it was like, in the ER, you have all of your nurse-driven protocols where you can basically work up patients. You ask the doc for an order for, radiology stuff that's kind of out of your scope. And I remember, like, man, this is so much fun. I'm basically working sort of like an NP minus doing procedure type stuff. And I remember, like, getting to the end of that shift and being like, man, I think I could do NP.
Yeah.
And then one of the nurse practitioners, I think it was LaRue, had to do a pelvic exam on, like, a 90-year-old woman. And I was like, nope, hard, stop. I was like, I'm not going, not going the NP route. But yeah, it has changed a lot. Like, when we started, it seemed like there was a whole lot more providers, like physicians, nurses. Now, there's a whole lot more NPs, which, is a mixed bag. But, like, what is it going to look like in 10 years?
I don't know, man. I think the landscape is definitely changing. I think there's a lot more, I don't know what term you want to call it, but the mix of nurse practitioners and PAs, the physician assistants and stuff, doing a lot of the care, and some of, that's certainly multifactorial, but there's always going to be a need for ER physicians. There's always going to be a need for ER in general, even if AI takes over the world and it becomes like, Terminator and Judgment Day and stuff. Like, as long as there are motorized vehicles and substances to ingest, that's not just a toxic, it's an ER thing. There will be a role for the ER, because someone will do something stupid and they'll say, hold my beer, and then they'll need an ER provider. So I'm not worried overall about the need for ER. There's a lot. We could have a whole podcast about the way like medicine's going and reimbursement and the struggles and how like payment is set up and who's providing and getting what. I think that's fascinating. That's something I'm like interested in, and does kind of get me on a little soapboxy. Yeah,
that was one of the questions that somebody, a couple of people had asked about that. Like, where do you see us in 10 years or something? And I do think you're right. The ER specifically is like, AI can only do but so much, I suppose. I mean, who knows? Maybe in the future it'll be different, but like because radiology stuff now is getting read by AI in some places, and it's apparently doing a pretty good job. But you're still going to have somebody that kind of reviews all that stuff.
You still need oversight. And I think a lot of some places right now are trying to do more, like if you're a satellite hospital or your urgent care is staffed by nurse practitioners and PAs, they want to have like a telemedicine physician, quote unquote, over them. I don't know why I'm doing air quotes on a non-video podcast, but there we are. And
someday it'll have video. Once we're not in an unfinished basement, we'll have some video.
I don't know. I like the tool chest and the old military
old
stuff.
code card, man.
Yeah, it's a kind of a cool. It's a very man cavey vibe down here. But so I think that's going to happen to some degree. It's so hard to predict. I think less people overall are going into medicine, like physician, like med school and primary care, because of how reimbursement is and because you're spending, I mean, I spent most of my 20s in the library, right? So, there's a lot of sacrifice to be made, and then when you get out, there's like expectation, I guess, and when that expectation isn't met, people get burnt out. And sort of to what you said earlier, if if you end up not liking something, if you find out you're getting burnt out in ER as a PA or an NP, you could transition to a different specialty. But as a physician, you have to go back through residency unless it's something peripheral related, like internal medicine. You could do like nursing home or urgent care or primary care, certain things like that. But you're still within a very small scope of things that you can do.
Generally put yourself in a box.
Yeah, you're a little more boxed in. And I think overall, it seems to be the culture of like kind of respect for physicians has gone down. I think culturally it's still a respectable field, but like, I think the classic of, my doctor, trust what the doctor said, and the tad physician, and trusting that has been decreased over time. And I think people notice that, and it's generational, it's cultural stuff too, of like people not wanting to go through it.
It's all right. So all right. Some questions.
Yes.
All right. So that one that I sent you, because it was not a fair one to just throw at you out of pocket.
The mercury one. Yeah, that's a good one. Heavy metals are always interesting.
So I'm going to ask the question here. This was a buddy of mine. He's a ER physician out in Portland, Oregon. Or no, Washington, Seattle, something. He's on the West Coast. It's all the same to me.
Pac Northwest. It's rainy and cold.
Yes.
Got it.
Yeah, that's it. He said, what is the likelihood you can develop mercury poisoning from eating sushi frequently? And what level will you start seeing symptoms? Had someone yesterday come in for mercury level over 1. He normally eats large sushi meals 2 to 3 times a week. Follow-up question. Actually, we'll get to the follow-up question.
Okay.
First one.
Do that first. So yeah, you can. So all right, here's mercury is condensed version as I can get. So there's 3 types of mercury. There's your quicksilver, like in the thermometers, right? And so that's fun. You can play with that. It's fine. But don't vacuum it or aerosolize it, because when you inhale it, it's bad. That's not good. There's inorganic mercury, which is like in with the chemicals and combined with other ores and things like that. You see that in like industry. And that's, again, more of an inhalation kind of thing, blood exposure. And then there's the organic mercury, which is the fish mercury. That's the one that most people would be familiar with, or you're most likely exposed to. So for the most part, and all this stuff is governed by the EPA and FDA. They test all your cans of StarKist, any restaurants. So, you're at higher risk if you like fish your own mackerel and eat your own mackerel off your boat and, doing your own deep sea tuna diving, you're more likely to get it. But the more mercury rich fish you ingest, you could get it. So if you eat like 5 meals a day or 5 meals a week of like shark or swordfish or, tuna steaks.
Essentially a wild caught fish.
Yeah. Okay. So it would have to be wild caught, right?
So you're probably not getting it at the Sushi King.
Right, exactly. So if it's farm raised or if it's whatever, it's less likely to have it than actual fresh caught. But it's in everything, right? It's in all different fish, but there are some fish that have more of it. Shark, mackerel, the big beefy tuna. You're less likely to see it in like salmon, shrimp, canned tuna. It's pretty darn small.
Gotcha.
The levels are very dependent on like what the units are. So I don't know what one actually means. If that's
every like lab essentially has different.
It's different cutoffs and stuff. So the symptoms you're gonna see. Nausea, vomiting, diarrhea is the most common symptoms.
It's my
of like
favorite.
Literally
diarrhea is my favorite.
Diarrhea is everyone's favorite. It's every.
All right, would you rather have diarrhea for a week or vomit? I'm gonna say 3 times, and not just like a little vomit, like a full on like violent vomiting.
Like violent vomiting,
but
one day.
Yeah, like 1 day of vomiting 3 times, or a week of diarrhea.
Vomiting.
Okay. I also go with that route.
Yeah, I hate vomiting though. I hate when our kids vomit. I hate smelling it on patients.
I think being in the ER forever has like kind of made me immune to like people puking, because I will just be doing my thing, like drawing labs while somebody's puking over their left shoulder while I'm on their right. But it's like, vomit is my assigned task as the dad here.
That's true.
So it's like Lexi's like, no, I won't do that. But I mean,
so does she take the poop? Does she take the diarrhea?
She does do more of diapers? That. She probably does some more of the poopy diapers, especially like for our newborn. Like she's been doing more of the diapers since I don't really want to see a freshly circed wiener. Like it's just not what I'm about at this point in my life. Probably won't ever be at a point in my life where I'm like, yes, sign me up for that.
I don't think that's anybody's thing. Hopefully not.
Yeah. Gosh, you've got problems.
Yes.
All right. So the follow-up question for the mercury.
So just eat normal amounts of food and you'll be fine. If you're exclusively a pescatarian, then
I learned a new word.
Just be careful. Yeah, you only eat fish. But most people in everyday American diet will be just fine, and you're not going to get mercury poisoning.
Okay. So people that get comprehensive blood draws out of pocket that are getting heavy metals, how helpful are these tests, and what are common causes for these to be elevated? Like arsenic, cadmium, mercury, from tinned seafood and sushi. So you kind of answered the tinned seafood thing. Like you're generally not going to get it if you're just eating like tuna 5 days a week from like the can. But some of these other ones, like, I don't know.
So all that stuff's all over, right? Like arsenic, cadmium, they're all in the environment. Like it's in the water, it's in your soil. So unless you're having particular symptoms or you're like living an Agatha Christie novel and you're like getting poisoned, it's really not super helpful, because like you could draw my blood and I probably have like some detectable amount, but you know.
So when we cut your hair later, we can probably get some arsenic out of you?
You can get some arsenic out of my hair. Well, and that's it, hair levels versus blood levels and urine levels. This is a whole like sub-niche even in toxicology that people talk about, and what's good to test and what's the best method of testing and what lays around later. So when people get into this and they're worried about poisoning, if they're being poisoned by somebody, but so
is that like a common thing in tox, like where you're like people are like, somebody's poisoning me?
Oh yeah. Absolutely. Yeah, we'd get those consults, and we had a clinic. This wasn't a very well known thing because we tried to keep it sort of hush hush. But we actually had a toxicology clinic, and some people would get referred to it if they were like didn't have any other thing, or they actually had like crazy elevated levels and needed us to follow up. It felt a little like house, but not quite as cool, because you really had to ask them everything, and like we'd talk about their hobbies and what they would do at their house. Did they have
were dumpster diving in their home?
I never actually went to anybody's home and investigated or like looked under their sink, but you would ask some of those things, so it felt a little house-like. But
that's pretty cool.
Yeah, but there's people who swear they are being poisoned.
Did you ever have anybody that you're like, they might be?
Not like nefariously poisoned. My supervisor or like mentor, Chris Holsteg at UVA, he's like the director of the Blue Ridge Poison Center. Shout out. He has worked on some famous cases, and he's been a consultant for some of the like Russian poisonings and things like that. Yeah, he's done some.
Well, I guess he's.
He's a pretty well-known guy.
His son
in the
is
world.
One of the other ED docs, so yeah, I guess he would have been around probably practicing during like the Cold War, right? A little afterwards, for sure.
A little
but
bit,
like in the
afterwards.
80s, I would guess.
Yeah. I mean, he was definitely
so like before the fall of communism, he was like, that is wild.
Yeah, like Boris Yeltsin? I think that he.
Boris sounds right.
Boris sounds. Moose and squirrel. But yeah, so well water, if you have well water and you're starting to have weird GI symptoms, test your water, right? That would be something that groundwater can, or the ground stuff can leach and be in like well water. But for the most part, most people are going to have symptomatic levels, and it's not going to end up doing anything. There are occasional outbreaks of stuff. Like part of what we had to learn was these historical outbreaks of like arsenic and cadmium, but most of them were very international, where stuff wasn't being regulated. One of the benefits of regulation here in the United States is that happens very, very rarely. But if you're actually worried about it, you can always talk to your physician and test stuff. Like you said before, this does not condone medical advice. I am not your doctor.
That's right. That is right.
But for the most part, I would test. If you're worried about it, you could get testing. But somebody just walking into the ER with a bunch of labs that they paid for as an outpatient, I would probably not do much.
Yeah, I would guess not. Hey, you want to try this beer?
Let's do it. Yeah. I'm not working today.
Me neither. I'm not working for a while.
I work the next 3 days. I was very disappointed that I work tomorrow.
It's a little late, but we're gonna have brunch.
I mean, it's still.
Yeah, it's 3
It's a little late for brunch.
It's never too late for brunch.
Dinner.
Yeah,
lunch,
that's right.
Dinner.
Yeah, this is Beals. Beals doesn't sponsor us. Nobody sponsors us. I suppose the AMDG Performance Coaching sponsors us.
Sponsored by AMDG.
But Beals Brunch Stout. Delightful. Cheers, my good man.
Cheers, sir.
I got nothing. Cheers is good enough.
Drugs, Jesus, and everything in between.
Indeed. I dig that beer. It's pretty good.
Ooh, that is good.
All right. Let's work through some more questions, and then I don't want to take up too much more of your time. I don't have the money to be paying doctor hours,
I am not being paid for this. This is out of the... This is just for... I'm here for the ice bath. That's the real reason.
That's right. All right. So this, I believe, was... This one is from Brittany B. Murph. Brittany Murphy. Shout out to you.
out.
and all your good work. So finding time in busy life to remain active, work out, run, and do the things. Especially when you got to come out to Southside, because that's like turns into a long day for you.
Those are long days, yeah. So those end up being like 12-hour days usually. So I try to get up before the kids. If I don't work out before my kids get up, then that's pretty much I'm hosed for the day. So my wife will kind of help them get up, and she's not an early morning person by any stretch.
Are your kids morning people?
One of them, Riley, she'll get up early sometimes, but she'll stay to herself and
How old
go
are your
read
kids
or
again?
do something. 9, 7, and 4.
Okay.
Yeah, 2 girls and a boy.
Nice.
So yeah, it's a party at our house. It's
That's
fun.
right. Always a party.
Always a
You're
party.
gonna have a big
not
party
as much
tonight
as a
with the
party of
game
you. Yeah, no,
Yeah.
You got a big party right now.
Yeah, it's a fun time. It's a fun time.
A new party.
Yeah. So before, if you're gonna make something happen, like exercise wise, it's got to be the morning.
Yeah, it's got to be in the morning.
I'm the same.
Because our schedule is so all over the place.
Yeah, yours is
Sometimes I'm done
super
at 4
erratic.
p.m. Sometimes I'm done at midnight. Sometimes I'm done at 7 in the morning.
And
But if
sometimes your
I'm-
commute is 5 minutes versus an hour.
An hour, yeah. So I usually try to work out in the morning. When we had less kids, it was a little easier to, and they were younger. Like they would just sleep in the middle of the day. I would go sometimes in the afternoon and like go for a run, but usually my quiet time is in the morning before they get up when
Yeah.
everybody's asleep. Because once they're up, it's balls to the walls.
Yeah, it's game on.
It's game on.
That
It's
is
dad
what I've
mode.
noticed. Like
It's dad mode.
unless I'm gonna run with the kids, or create some weird workout where I'm like doing a throw a kid up in the air and catch them and do a squat and stuff.
Yeah,
like
they're like a wall ball.
kind
It's
of.
like a
You just
child
don't
wall
want
ball.
to. Yeah. Just like there's more like ceiling. If you can get their head to touch the ceiling, and we have cathedral ceilings upstairs, so like.
I mean, if you can go that high, that's pretty good. Those are strong traps.
That sounds terrible. That sounds horrifying. All right, got some more. I'm the same. Like if it's not going to happen in the morning, it's probably not going to happen.
Yeah.
And that's for like quiet prayer time as well. Like because after this is like one of the things that every saint from like scripture, I think in like the Old Testament talks about like praying in the morning.
Yep.
And then, St. Ignatius of Loyola, who was like around in the 1500s, I think, he talked about like, and St. Paul talks about it, like pray without ceasing.
Mm-hmm.
Everything you do can be a prayer. So like exercise even was St. Ignatius of Loyola's deal. Exercise done right can be a good prayer.
Mm-hmm.
And if we're like temples of the Holy Spirit, like if God dwells within us, then our bodies is something that should like manifest him dwelling within us, not to be like, oh, you got to be a Greek statue or something, but like the whole dad bod thing I think is kind of nonsense. Like, yeah, you don't need to have like an 8-pack abs and have a 2% body fat or something, but
Right.
we also shouldn't be fat.
I prefer the term father figure.
Yeah,
opposed to dad
yeah,
bod. Dad bod's
you're a good
offensive.
father. You have a good father
I have a good
figure. It's
father
not
figure, yeah.
not a dad bod. I like it. But yeah, if it doesn't happen in the morning, it's not happening. And whether it's prayer and we like structure some throughout the day, so we do some prayer in the morning, noon, and at night. But
Yeah.
but like for me, I can't give what I don't have, so I have to. And there's nothing that I
Amen.
will ever say that's original. I think it's like Ecclesiastes. There's like a line that's like my favorite, and it's like nothing is new under the sun.
Right.
So there's nothing I'm going to say in any podcast or anything ever that's new, but
It's
like-
still good to have those reminders, man.
yeah, like if I don't have it, I can't give it to my kids, so I have to like get up pretty early to pray. But since the newborn, like you said, it's
Oh, yeah.
a nut house sort of.
You got to take a little hiatus
like-
on the routine.
Well, it's just like figuring it out again, and I think having some patience with your environment and yourself, which I hate to be like, be patient with yourself because life is hard. No, like screw that. Life is always going to be hard, so you have to
Correct.
figure out how to adjust and adapt to it. The difference is like, don't be a hypocrite. Don't like say these things and not do them, but also recognize your human frailty. So I am a frail human being very frail. I might get in ice baths and like try to do the hard things, and I truly believe that men should definitely be doing hard stuff, because there might come a time where you and I have to do really hard stuff, and we don't have the option to not do it.
Correct.
So like that's part of the reason I do all these ridiculous nonsense things like ice baths and run when it's like 12 degrees out. But I have to do whatever the thing is in the morning. I have to like really buckle down and do the certain things when I can do them, but also be flexible. Like that's a big thing that I've found, is be flexible with, your kids, your wife, and like my wife is really awesome about like literally everything. So I don't ever like have to stress out about stuff, which I know not everybody has this. Like it's an awesome blessing, but just making the time when you can, and sometimes that means 5:30 in the morning. Absolutely. When you don't want to do it, when your day off or whatever.
Yeah. And having, right, grace is new every morning, but there are certainly seasons where we have to give ourselves a little more grace, or give our wives a little more grace, or our kids a little more grace. And
I think the word you're looking for here, and I hate to be like nitpicky, but I've recently found that I'm annoying about this.
No.
Words like, because we say grace, and what we actually mean is like patience. Like, because I think grace is like an overarching word that we use for like virtues, like patience, prudence, temperance, like all of these things. Speaking of which, that poster up there,
I love it.
Yeah, Lexi got it for me for Christmas. But like patience, like whatever it is, I want things done like 5 seconds ago. I need to be patient with everybody. Like I'm the biggest impatient butthead most of the time. Whether that's outwardly manifested or not is kind of irrelevant, but be patient with whatever it is.
Yeah, maybe patience and forgiveness too, because sometimes it's I didn't do my workout yesterday. I'm such a, and you can get down and cycle on yourself. It's like, okay, that was yesterday. I'm going to do it today, and I'm going to get back on it, and I'm not going to let myself stew and fall into that bad cycle, but I'm also not going to fall into the cycle of like condemnation either. So you have that.
That's a difficult thing that I've found. There's a priest who gave a homily, which cracks me up. So I guess Catholics refer to sermons as homilies. I don't know why.
It's a cool word.
But most people are like, hominy grits? What? It's anyway.
Hominy.
Exactly. So this sermon or homily, however you want to spin it, he said it's important not to mistake human frailty for hypocrisy. And like that hit home, and I heard that when I was in infantry training in the Marine Corps. So like 15 years ago, maybe. 14, something like that. And I was like, dang, that's it. Like that is 100% it. Because how many, you get to the end of the day and you're like, I didn't work out today. Or say you get to like 3 PM, you're like, I didn't work out today. Or I didn't pray today. Well, the day's lost. It's very easy to like just kind of abandon the day and kind of just resign yourself to, I'll just pick it up tomorrow. And not to say that I'm always good about this, but it's like, well, no, I can do something.
Yeah,
whether it's,
you can still do
and
that
it's
prayer.
just about like consistency. So even if I'm just doing like 100 push-ups, which I got an app recently that like I'm gonna track all this stuff for the year, which I think I can send it to you, and it's like free. Otherwise, it'd be paid. But because I got like the family deal, but
maybe they can sponsor the app.
Yeah, maybe. No, doubtful.
Do push-ups in the middle of the app. Brought to you by.
That's right. By Habit Fitness or whatever. No, but being able to just sort of salvage what you have of the day. Like say it's 3 PM, I didn't exercise or I didn't pray. Well, I've got 5 minutes.
Yeah.
It doesn't have to be a lot, but just doing that one little thing when the time comes is solid. We're falling right into the the trap of every podcaster everywhere. What's your daily routine look like? What's your workout?
Yeah, I don't know.
It's somewhat cringy, but also like, I don't know. I have this terrible problem of monopolizing conversations.
It's all right.
But
it's good. You have a lot of good things to say.
Don't say that. Like I said, I'm an arrogant punk. Don't say things like that. But the thing is like, because I've been asked a handful of times, why in the world are you doing a podcast? Like you have enough on your hands.
Yeah.
True. But the main reason is I wanted to drink beer with my friends and talk about temperance and how we only drink a few.
Right. There you go.
But in reality, like, we all have our sphere of influence, and that's only but so big. And while, you and I have probably shared a handful of podcasts or things between each other, and like, we'll listen to them most of the time.
Yeah.
But if I give you something that I made, you're more likely to listen to it or look at it.
It's true.
Like, my wife told me that she found she was at work and started reading this thing, and she's like, "Oh, it's Justin Rizer." It was some I don't know, some sort of article. So we've got a real doctor who's published on the show today. But yeah, I don't know where I'm going.
Too kind, sir. Too kind.
It's rare that I'm accused of that, so I'll take it when I can get it. All right, I have more questions. I don't know if we answered any of those, so if you're one of the 5 people who are listening, take it with a grain of salt.
What was the one Brittany asked?
How do you find time? And
find the time.
We kind of beat that dead horse. I'm good. You've listened to this podcast. Yeah. I beat dead horses a lot.
Hey man, whatever.
Equine violence for sure.
Equine violence.
I'd like him to discuss his take on having Christ in his life while being a doctor, because there are so many providers who are atheists. Not that I think it affects his decision making, but what role does it play in his practice?
So
that's a heavy one, Brittany.
That is a heavy one. It honestly, it gives me so much hope, because we see a ton of despair and death and destruction. And I mean, if you just take an average ER shift and see all the just crud and stuff that people go through, not even like that I go through, that I just see people experiencing and having to deal with. And if you were to take that on just solely or just hear it and stuff, man, it's heavy. Like, a lot of the stuff is heavy. And it's not fully every single shift. Like, we laugh a lot. We have a lot of good dark humor with our, staff and colleagues that help us through, and, like the working out and all that stuff helps to reduce this. But man, that baseline foundation of Christ and a hope for a future and a hope that his plan to make whatever is happening into something that will ultimately be good, even if it's not seen by the person going through it, even if it's not seen by us in this lifetime, that he is working that plan together for his greater good. Just having that hope helps me, because I mean we've seen some sick stuff, right? And some like devastating things. And so I don't know what I would do if I didn't have Christ, right?
Yeah. I think that a lot too, because, like you said, we've worked with plenty of people who are atheists or agnostic, and I think there's a meme that has circulated around, and it's like these, like, oh, you just use God as a crutch, like you're just a weak person who needs to believe in this, otherwise you're, hopeless. And it's like, well, actually, it's kind of it.
Yeah.
Like,
I am weak and broken, and I need something bigger and more reliable than me. And it's God.
Yeah. It's a beautiful reality that we have God in it, but it is still challenging though, because some days, you got somebody that's young that you end up having to diagnose with cancer, or refer to the oncologist, or somebody that's, commit suicide, and you have to deal with this, and you have to deal with this in some kind of way. I hate to say, like, I don't know how I would do it without God, because I've never been in a position where I didn't have God to lean on. Like, I never, there was never a time that I did not have Christ to lean on, and have the consolation that all things, God can use all things to his good end. I know this is scriptural, but I'm, like any good Christian, I'm good at butchering and paraphrasing the scripture. But yeah, like, does it impact your practice, do you think?
I mean, yes, because I think I can bring hope, and I think I can be a positive light to people, because I think if I didn't have Christ, I'd probably be even more cynical. And I'm already kind of a cynical guy, and I'm a little crusty sometimes, some days more than others. So I think so. I mean, I think it gives me hope to continue on and to like just show up and do the best that I can, because it would be, I think, easy for me to just get through a shift and be done and do what needs to happen. But like, because of that belief, like everything, like doing my work as unto the Lord, like being able to imagine this as my family member and trying to rehash that. And again, this isn't every single encounter, right? Like, I'm not saying we're perfect. I'm not saying that I, am some special guy, but having that sort of foundational construct, I think, provides me some like ability to give hope and happiness and joy when I try to walk into a room, as opposed to like just faking it and putting on a happy smile. Like, there is some, it's not just me trying to put on a smiley face. It's this contentment and it's this baseline hope and truth and stance that I have that allows me to have that.
Yeah, because there's actual substance there. It's not fake. It's not, manufactured.
Right.
It's real that you can bring to somebody. Like I said, you can't give what you don't have. And if you point out like the light, like this has been actually come up a handful of times in like my daily Bible readings and like the daily readings at Mass, is like the light of Christ. Like, we don't put it under a bushel basket. We don't do any other nonsense with it. This light that is in us, like, we're supposed to be shining forth with it. And I think when we can, we're frail, we forget about it. So it's easy to kind of trudge through and not be joyful and not have that light very broadcasted. But if like being intentional in those moments where, you're walking in to tell somebody some bad news, or even if it's just like a toe pain, and you're like, all right, how do I look at this person as Christ would look at them? Like, that's something that is helpful for me. And I think that you probably are similar. Like, it's somebody, whether it's actually their worst day or not, you can look at it and say, look, they think it's their worst day. I can help them through this, pseudo worst day ever.
Well, and that's where, that's where I think we really shine, is when it is the worst day ever, and staying calm. Like, I mean, the toe pains, like, can be annoying, and I don't...
Look, if your toe is falling off, you should probably be in an ER.
Right. Like, we'll still listen. I'm going to treat everybody with respect as
Nobody's
much
going
as
straight
I can. To jail. Right. But, like, that presence, I think, really shines, and that light really comes out in those bad and harder moments. And like, when somebody is having a miscarriage, or when I am having to do the cancer diagnosis, and I think that's probably the worst part of the job to me, I think, is telling somebody that they have cancer. I think that's the worst. That and like pediatric codes. But but the cancer thing, fortunately, happens more often. But that's where you can sit and be a positive presence, as opposed to, and when you drop that on them, you can offer prayer. And that's probably the time that I've had most of the interactions of like offering prayer, has been that or like a family member that they know is dying, and being there for them. So I think that's where, at least in my practice, it comes out the most, is in those harder moments or harder situations, as opposed to just being like, yep, that's it. I mean, if you sprain your ankle, like, you don't really need like super in depth. We all need prayer, but you don't need like this detailed like, dear Lord, like, please heal, be with you through this terrible trying time of your ankle sprain. That doesn't happen. But in the harder situations, that's where I think it shines through the most.
Yeah. All right, next one, still from Brittany. She gave me 3 questions.
Is this our Brittany?
Yeah, our Brittany.
Oh, nice.
Yeah. Do you think, as a medical professional, we go against God's will with the advanced life-saving measures that we do, especially for, say, the 96-year-old Meemaw, who has seven different types of cancers and a missing leg? So, like, the 96-year-old full code that is bedbound. Like, I kind of... Well, this was a question for you, so I'm going to let you answer that.
That is a nuanced question, Brittany, and a great one. Thank you for asking it.
It's so polite.
Gosh, it's so multimodal. I think I will try and... I'm pretty verbose, as you can tell, and I like to hear myself talk.
Look, we've only been
also.
going on for like an hour and 26 minutes,
It's fine.
and half of that was like a pee break because I have a bladder the size
That's
of a thimble.
true. Yeah, same here. I'm like
So are we doing too much for these people in what the last
So I will
stages?
say I am not for euthanasia. I think that is against God's laws. And I would not be in support of euthanasia. I think we are harming people by this artificial prolongation to some degree. And I think there's a separate side of me that goes like financially and for our country and just healthcare in general,
Mm-hmm.
all this money and effort and resources spent for something that's going to have exceptionally little, if any, benefit is probably a pretty big waste.
Yeah, and that's a hard thing to hear, especially like as a Christian, when you hear like, oh, keeping this person alive, which God gave us life, so it's a good thing to be alive.
Mm-hmm.
Keeping them alive is wasteful. And you're like, well, that seems wrong. However, like, all right, so on this poster, prudence is like the cherry tier of all virtues. So you like right judgment in action is like one of my favorite descriptions. So the best way I've heard this was, say you are living, they worded it like you were in a tribe in Africa and you had to travel like 100 miles on foot to get to a dialysis.
Mm-hmm.
So, and it would cost your family basically a year's wages to like support like a single round of dialysis or something like that, which isn't unreasonable to think. If you have all of this money going into something that's life-saving for the person, but it buries the family in debt so that they will live with the financial burden, which again, it sounds bad when it's like, oh, financial burden, that's somebody's life. Indeed, it is somebody's life. But where we do play, I think we do play God, where we're like, we can keep them alive. We can put in a peg tube. We can do all of their feeding through a tube. They can be bedbound and we'll just turn them every 2 hours. And they'll live for another 2 years and they won't be able to talk and they won't be able to walk and they won't be able to do anything but blink. And then they'll stop being able to do that. I think that's an injustice to the dignity of the human person. But I also recognize that we should not, like, I agree, euthanasia is always bad. Withdrawal of care, and when I say withdrawal of care, I don't mean like chucking people in the ditch.
Right.
I mean giving them death with dignity, where you're still caring for them, but you're not, keeping them alive on Levofed and, all these drips and stuff. I think there is a balance that needs to be struck. And very often in healthcare, I don't think we do it. I think because families are like, I'm just not ready to let go. It's like, well, they are ready to let go. Their body has decided that it's done.
Right.
We should not be doing this anymore.
Right.
And that's hard.
And it's hard to tell people. And, sometimes you think, well, what would I want done with my family member? I think is sometimes a decent gauge, but I think you're 100% right that I'm not ready to let go of grandma yet. It's like, too bad.
We're never going to be ready.
Like grandma's going to die. Like whether it's now or a year from now or 5 years from now, like it's going to happen and you're never going to be ready. You're never ready for a close loved one to die. And there's times where it seems more like appropriate, like a 96-year-old great grandma who's lived a full life, and I think that's certainly more justifiable to pull back resources on that as opposed to like a 10-year-old with cancer, right? Like you're probably going to do more stuff for that. But yeah, to answer that question, I think we do an injustice to our elderly population in keeping them around, quote unquote, artificially for too long. Sorry,
Yeah.
I keep looking outside the window. It's so beautiful here. But it's also I find that hard to regulate on a national level that would actually effectively make a change. So it really is this individual level, and I think we can talk to people and impact them because so many people don't know. Like, they don't know what it is that they would have to go through and sustain. And so if we can say, like, you don't want me to do this and basically torture your loved one for a couple months.
Well, they'll pull through. It's like, okay. And there's some doctors who are really good, especially some of our hospice docs. I know the Gazans are really good. Really good. And it sounds bad, like they're really good at convincing somebody to be a DNR. It's like, no, they're really good at explaining that doing CPR, the cardiopulmonary resuscitation, where you're breaking ribs, beating up somebody's heart to keep it pumping, essentially is what you're doing. Like, you're punching somebody's heart between 100 and 120 times a minute for up to, we've coded people up to an hour.
Right.
And, they live, and actually some do well, but I think the majority doesn't. And it's difficult for families for sure. I think we kind of, again, without beating the dead horse, I do think the answer is we do too much in most circumstances, and maybe the education piece needs to happen earlier on, and maybe providers need to be more empathetic towards the family who are going through this, because we see death all the time. Like, it's a daily occurrence.
Right.
I've had to tell dads that their newborn babies have died. Like, that's a thing.
That's tough.
It sucks. It sucks. And both times it's been when I've had a baby due within like weeks. So that's been difficult. But at the same time, like, if we can be empathetic towards these people in these moments, which, like, thanks be to God that, honestly, that I was in the positions that I was, because I've been able to, one, I'm a cryy person, very sympathetic crier, but having to see one of my worst fears played out on another man, which sucks so bad. But, like, I can come to that person just beat red in the face, ugly, crying, and being like, look, I don't have words. There are no words. But I'm really sorry that we've done everything we could. It's different when the person's still alive, I think. But at least in the moments where you can be empathetic, where, like, hey, look, I know your loved one the prognosis is not good. I wonder, though, was there a time in medicine, like all the nurses, I think this way, was there a time in medicine where you, as the physician, could basically terminate resuscitation efforts? And I don't mean just in codes. I mean, like, hey, look, she's 90 years old. We're not going to put in a dialysis catheter and do these things. Now, I know in Europe, Britain, somebody on one of the posts that I had talked about this, but you can't, where they won't put somebody over 80 on dialysis. Like, they won't use the resources for that. Yeah. So I wonder, was it ever a time in American healthcare that like in your time, where you could, as the physician, say, hey, look, we're gonna withdraw care because this is, I don't want to say inappropriate use of resources, but essentially yes.
So it's not as, I've been a part of conversations about, like, goals of care, countless times, and I think it's been when we don't say, hey, we're absolutely, like, we're taking this off against your will. Like, that's not a good way to put it to people necessarily, but of, like, hey, this is futile. Like, this is not going to work. Like, your loved one is is dying. We're not going to get them back. And if we do, there will be no quality of life. We think the best thing would be to stop doing all this stuff.
And that's a hard one, too. That's a really hard...
Those are hard conversations to have.
Words is super hard to swallow, too, because you're like, well, we just talked about all life being, like, precious. Like,
yeah. But it's like basically they won't be there. Like, they're not going to be interacting. They're not going to be who they were before.
Yeah.
Right? And so, like, they're not going
and not
to
even
make
just
it.
they won't be who they were before. Like, they'll just be laying in bed for the next, 2 years before they die.
And this sounds bad, but it's a burden.
Well,
like
it's also, I think, a
burden.
mercy. I think maybe there was a time, reading all of these books that I've read over the past years about like the lives of saints where they are very hopeful for, the life in the world to come. We have a very distorted view of death. Like we look even among Christians, we're very opposed to death.
Mm-hmm.
I mean, if we, as like Paul says, like persevere, like Jesus said, like he who perseveres to the end. Like if we can run the race, like it's Jesus, and then Paul says, if, run the race as if you are to win. Like I'm not saying I'm not afraid of death, but like I think generally people just need to be more okay with dying.
Yeah. That's
Yeah. All right.
That's the hard thing.
Yeah.
Hard pill to swallow. But you mentioned the. I'm gonna pop back a little bit. You mentioned the ugly crying. So I've cried twice ever on in the ER. Not ever. I've cried many times, but on ER shifts. Both of them were in Southside. Believe it or not, but one of them was like a pediatric code.
Yeah, those are. If you don't cry in those.
Well, and there's been other pediatric codes I haven't cried, but there was one in particular in Farmville that I was
haven't. There was one that I did with Kumar. We did
blubbering about.
You did blubber.
With the parents.
Full send. Blubber away. Ugly cry till your heart's done.
Right. But then you mentioned like the family having to hear something, and then the exercise being like a prayer, like jumping back to that. I remember when Angela, we were going for our an ultrasound. Like she found out she was pregnant. We'd had Riley and Remy already, our two older two, and she was pregnant again. And we went to the ultrasound. She hadn't had any bleeding, no pain, no nothing. We were like, just a normal ultrasound, no heartbeat. Right, and you unfortunately
we've dealt with those too.
We've dealt with those too, right?
Mm-hmm.
And so I remember going on a run and having like scream prayer with God, like emptying my heart out, just about that, and just letting Him listen and letting Him have it, and then letting Him speak to me. But physical activity can be prayer.
For sure.
Go into that, but then the empathy and the hard time that comes with those things that we sort of see in the unexpected stuff. But yeah, man, it's a roller coaster.
Yeah. Well,
this life is a roller coaster.
It is. Well, I mean, exercise of prayer. Like a couple weeks ago, our good friend, like one of my best friends, the first friend that I made outside of like my hometown.
Mm-hmm.
Aside from like the Marine Corps, in the nursing world with Shane, who was on here back in November, within a month of recording that, or right just after that, he killed himself. Like that's a really hard thing, but exercise being a prayer. Like when I found out that day, I went and I ran 13 miles. Like I hadn't been running like more than 2 miles. Like that was probably not a sound judgment call. I also got chased by a German Shepherd. It was a rough day.
That added a couple miles to it. It cut it like 10 miles, but the German Shepherd made it 13.
Yeah, it was a rough day, but it was like in those moments where you could talk about coping mechanisms or whatever. Like there's something about just being so physically worn out after a traumatic experience where it maybe the word's cathartic. I don't know. It's just where you're so spent physically and emotionally that you kind of like God brings you to your knees to remind you like, hey, look up. And that was something super helpful for me, was exercise in those miserable times. And that same for times that I've had to do like pediatric codes. Like that's kind of the thing that I turn to, is exercise and prayer, which sounds cheesy and like, oh, just do these things because they're way better for you. Because some people don't respond that way.
Right. Some people have to do different stuff. That's just how you respond. That's how I've responded to stuff. I mean, that's just, there's something about, it's the ability to get out all that stress. I mean, you're turning that internal emotional turmoil and getting it out that way. Some people write, some people draw, some people sing. Some people drink. Some people drink. That may not be the healthiest one. We probably did some of that too. I definitely, But we run, and that's just one way to do it. Yeah,
get some stuff out.
Can I share? Can I share a Shane story on here? I wasn't sure. So the only the second other time that I've cried on a shift was around with Shane, and so it was at Southside. We were getting destroyed that day. I mean, tons of sick people. It was one of those just train wreck day. Everyone was like sick as can be, and like going in and this and that, and then we hear a page come in as like incoming pediatric trauma. I forget how old they like said they were, but it was as old as my daughter was at the time, as my oldest one. And they knew how it was, and like we're sending stuff out. We've got strokes, sepsis. It was one of those days like, I need another person here with us. But Shane walks up, and and I know there's tons of stories like on Facebook. Everybody was sharing all their stories. I'm just excited to share this one positive story among the many's for Shane. But he walks up to me and goes, "Brother, I'm going to pray for you right now." And he's like, "You can keep working and doing it on the computer. I know you have to. You don't have to pause, but I'm just going to pray for you." And we're like on the little doctor's alcove at Southside. And he just says a little prayer for me while I'm like typing furiously in orders, trying to get people transferred out. And then we go on, because we're prepping, like he had heard the trauma come in. And so we set up for a trauma. And like, fortunately, the kid's like, okay. But the kid's name was Riley, which is my older daughter's name. And like, again, thank the Lord, like she ended up being okay. But I remember after like we were running the resuscitation, we get it, and I'm like in full like physician head of bed mode, doing ABCs, go through, get it stabilized, pop, get her transferred, and then I walk out of the room and I just like, like, and I was just like tearful, and I was able to rebound pretty quick, but that was like on shift crying of like, okay, let out, because like in my mind when they said her name, I was like, this is my daughter here. Oh, dude, that's right. And that is really hard too. And that hurt. And so when I got out, I was like so thankful, and I texted my wife. I was like, I just need to know that everybody's okay. Yeah. Like, just I'll explain later, but just tell me everybody's okay. Everybody who's like got family, especially spouses who work in healthcare, has probably gotten that text. Mm-hmm. Like that's a difficult one. Yeah. Can we pause real quick? Yeah. Beware the yellow snow. That's right. Beware the yellow snow. All right. So we got a couple more questions to work through, and then I'll give you the rest of your Sunday. Are we back from our commercial break? That's right. It's brought to you by Beals. What's your main motivator? What is the main motivator for you each day? Man, y'all coming with the heavy questions today. Is this Brittany also? No, actually, sorry. No. Okay. Hold on. Let me back up. Like, this is Ashley Andrews. Shout out to Ashley Andrews. Yeah, dude. Another amazing nursing supervisor. I know. I love our soups at Southside. I really do. We have the best soup. How do you balance everything so well while having a sense of humor? Maybe the answer is dad, husband, and ER physician. Well, thank you for saying so well, because I definitely don't feel like it's so well. Ashley said that. I didn't say that. Well, yeah, I know. So thank you, Ashley. Leo knows it's not so well. But, man, I mean, there's definitely the faith piece that keeps me grounded. My wife, man,
Shout out to Angela.
Shout out to Angela.
I've never met your wife.
No way.
Dude, yeah.
How is that?
I don't know. Well, I will say you do come out my way more often than I come to Lynchburg.
You used to come out more, and then kids, and now it's true. In between. So we'll have to have
we'll do something. All right,
together.
Sorry,
anyway, sorry. So I mean, Angela helps keep me grounded. She's super supportive and just a lovely woman. But she does it knowing that I have the kids to like work for, and that there's that motivation kind of keeps me up. Like I got to keep paying rent for these kids and food for them.
Too.
Definitely keeps me motivated. But man, it is just a joy to come to work with some of the people, especially like just our interactions at Southside and Lynchburg too. I mean, there's lots of great people, but yeah, I don't know. It's just fun. I like to have fun. I like to enjoy and be silly. I think it keeps me happy. It keeps the people around me happy. I feel like it keeps me young too, to some degree. So I just like to be silly and make people laugh when I can, and just to have a good time. Like when I wore a Santa hat on Christmas Day and was playing some rap trap music and shaking my head all around. You know? It's just we gotta have fun, man. Like we do serious work and serious business. We gotta have fun, man.
Yeah, that's true. The Santa hat can sometimes not go in your favor as a provider. There was a shift I worked Christmas Eve in Lynchburg, and I was wearing a Christmas scrub top. It's like a women's cut scrub top too, but
nice.
It's like Christmas. I had a giant Santa hat. It like went down to my butt, like the little ball. It was huge.
Wow.
And I, this was back in Lynchburg, and one of the docs, I kind of like shots were fired from him. On like, it was just silly, like banter, or I thought it was. Okay. And he's like, "Hey, where's the note on this?" Like the nurse's assessment, like back on all scripts when you would get like the nurse's assessment piece first.
Oh, gotcha.
So the docs could kind of like know what they're getting to a little bit better than just the triage note.
I gotcha.
And then he's like, "Where's the note?" And then I told him like, "I'm sorry, I was busy with this other thing." So then later on, a patient left AMA, and he didn't know about it. So he came to the room. He's like, "Hey, what the heck? What's the deal?" And he had called me from the bridge.
Oh man!
And apparently he called me on speaker. And I said, "If you had read the note, you would know." So that went out on speaker, and I heard Dr. Voth laugh really hard and say, "I guess it's somebody's time of the month." Referring to the doctor's response to what I had said. And then I went over to the bridge because I felt bad. Like I didn't mean to like humiliate the guy.
Right.
I just was joking back because he had joked. So I come back over with my giant Santa hat and scrub top, like kind of like, "Hey, I didn't mean to, like, I'm sorry. That was kind of rude." And he chewed me out like crazy.
Oh man.
And was like, you are so unprofessional, blah, blah, blah. And then Dr. Voth looks at me and he's like, "Whew, really must have been his time of the month." He's like, "Don't," he was super nice to me about it. He's like, "Don't worry about it." He was upset about something else. So it was just funny. Santa hat stories, but all right, couple more for you.
All right.
If you had a piece of advice for somebody, what would it be? That is super loaded.
Like any piece of advice for anyone, anywhere? Or
all right,
like
so this is coming from somebody who's married with kids, and I think is trying to, like just general advice. Maybe not. I mean, we've hit a lot of topics. I don't think you should.
So, all right. I'm gonna make this a semi-long-winded. There's a reason for this one. So I don't do New Year's resolutions necessarily. Nothing against the people that do. I just personally don't anymore. But my wife and I do we try to do like a word as like our theme, kind of a theme of the year.
Yeah.
This year's theme is attention. So it's like paying attention, like to each other, to our kids more. What has our attention? Like, are we letting our attention be swayed to like Instagram reels all the time, or whatever, you checking emails obsessively, or are we reading our Bibles? What is our attention focused on? And I'm saying this both to myself. This would be advice to myself as well. So it's, what is your attention? Like, pay attention to what's getting your attention, right?
Yeah.
Pay attention to what has your attention. And then also like to live in the moment, because I feel like just with kids, they grow so quickly, man. Like our 9-year-old, had something popped up on my phone from like memories of when she was like 4 or 5, like pre-COVID, and like,
Well, she's 9. That's crazy.
Yeah, she's 9. And so like seeing those pre-COVID times, like, man, that feels like a whole nother world. And so like just that living in the moment and appreciating it. And that's hard. Like, that's hard some days. You can't 100% be, I love this. This is the greatest day of my life, when, you're getting kicked in the shins by an angry 4-year-old because you didn't give him the right sippy cup. But, overall, trying to, again, slow down, live in that moment, and pay attention. And I think that's mostly stuff I would give myself in a younger version of me.
I'm going to give you a follow-up to her question on that.
Okay.
What is the biggest threat to living in the moment?
Oh my gosh.
I know mine is.
I think it's distractions, which is, I guess, general.
It's always a distraction, but my biggest one is my phone.
Yeah. Oh yeah. It's the phone.
Terrible.
Yeah, for sure. It's the phone.
We make so many excuses as to why I should have a smartphone or whatever, but like
phone is our biggest distraction.
It's the worst.
Dude, I'm reading this book now called Anxious Generation.
Oh yeah. I've heard about this.
It's fascinating. It's about how basically the Gen Z became more anxious, and like how phones and technology and Facebook and social media, basically how social media made us worse as a society. And
I would
people.
agree with that.
And
I probably
just
don't even
how
need to read the book.
to it. Right.
I probably just know yes, I agree. 100%.
But it's by this like it's just a fascinating thing to have now as kids who don't have cell phones yet and don't have social media, of like how to get that. But it's coming soon, right? At least for the older one, like the questions are going to come up soon.
Yeah.
And so how to handle that and manage that, and even just in my own life, like, are my kids going to remember me as dad holding his phone? They're,
dude, is
there going to be, is my face going to be half covered with an Apple thing? And again, there's so many good uses. Like, I have to have my phone. I can't even prescribe certain medications without having my phone.
I didn't know that. Yeah.
So any opioid you have to prescribe, you have a separate app that you have to confirm.
Dang. I didn't know
that. Yeah.
So it's
any controlled substance, not just opioids, but any controlled substance.
Crazy. So that's a good point, though, about like being intentional with stuff. The good use of technology, while the like social media and all these things are problematic, but like, all right, so the devil is real. Mm-hmm. I'm sure anybody that listens to this podcast probably agrees with me on that.
Mm-hmm.
And what does the devil wants to do is to take anything that is good and manipulate it so that you start abusing it.
Right.
Whether it's, alcohol, sex, whatever, anything. I think technology is one of those things that is a very good thing.
Sure.
And that's why it's so easy to manipulate and make a problem for so many people.
Right.
I mean, even for you and I, like if we looked at our screen time, we would probably be appalled and not want to say it, on a podcast. But
yeah,
I think that's the big thing, is just cut out the time. It is a good thing, and when our kids get older, you can't say, look, don't like ever have technology, because it's a good thing that you and I need for our jobs.
Right.
But
and like
navigation of such is difficult.
Yeah. And like, I mean, watching a few reels about the hilarity and ridiculousness of parenting or being in medicine, like sometimes those are a form of catharsis, right? And you're like, that's
validation.
Funny. Like I'll send it. Like you and I have sent each other reels a bunch of times, right?
Heck, I make a lot of them.
You make a lot of reels, right? I mean, this podcast will be probably mostly watched on phones, it'll be
listened to. Yeah,
listened to, not. So I mean, I think that's good. It's when it becomes so much that I just spent the last 2 hours and I'm not paying attention to my spouse on the other side of the couch, right? So it's like everything there. It's like here's a good analogy. So Paracelsus, the great father of toxicology, said everything is a poison. It is just the dose and amount that makes it,
toxic,
right?
That's so good. That's so good.
Similar thing.
All right, say that again.
So everything is a poison. It is the dose and amount that makes it dangerous.
Man, that's good.
Right?
Yeah.
So similar to, phones and technology
how much
and
dopamine
beer.
You get off of this?
Right? If we chill and have a single glass of bourbon, over and want to talk about life, that's fine. If you're becoming addicted and it's becoming a problem and it's affecting your life negatively because you have so much, that's problematic. If it's your phone, if you check Facebook because this restaurant only has their menu online, okay, fine. But if you're ignoring your kids wanting to show you their cool backflip for the 300th time because you're watching Instagram
Let's
reels.
be real. Your kid's not even showing you a cool backflip. They just want you to acknowledge that they did a trick.
Right.
And it was the lamest thing you ever saw in your life. I'm sorry, kids. I was a kid once too, and I did the lamest thing ever, told my parents it was a trick, and they were very underwhelmed. But they probably acted like it was amazing because they didn't have a cell phone in their face.
Correct.
So I need to do the same.
Everything's a poison.
Dude, I don't know. I don't think we'll be able to end this better. I think we should be able to get this up pretty soon.
Okay.
I think we're right at 2 hours minus a couple of pee breaks and whatnot. But dude, thank you so much for coming out. This has been super fun.
Absolutely, man. This was a blast. Thank you for having me.
Yeah,
I'm glad I got to come out here and hang out in the ice bucket.
You didn't ruin a reputation. I definitely would love to have you back out.
Well, and hopefully we answer people's questions, and if there's more, most of the people are people I know already, so you guys can just ask me on the next shift later this week.
That's right. And we'll definitely have you out. We can talk about more stuff because there's super interesting stuff that I think both of us probably wanted to talk about, but we won't be able to get to.
Yeah, there's so many avenues we could go down.
For sure.
So, all right, brother.